Good morning, everyone. You have successfully navigated yourself to Kaiser Permanente's product introduction for KP Plus. Very glad you made it here in our winter wonderland that we're experiencing today. Just a few housekeeping items before we start. Introduction-wise, I'm Kevin Meyer. I'll be your host today. I'll be guiding us through the process today and the information you're going to get. Housekeeping items, you're all muted. So if your kids are home from school, they're in the background screaming, we can't hear that, so it's all good. You have down below a Q&A button. We encourage you to ask questions during. We probably will answer these questions at the very end. We'll have a panel of some additional Kaiser experts that at the very end of this presentation, we're going to present these questions and have the appropriate person answer them. Sometimes we answer your question in the middle, and that's fine too, but encourage you to ask questions as you can. So with that, I'm going to introduce Amy Benish. Amy is going to do the bulk of the lifting today. Amy is a senior director in our national product department, the subject matter expert for KP Plus, knows all the answers, is going to do all the heavy lifting. I'm only going to steal a little bit of Amy's thunder ahead of time, but she's got all the details for you. Next slide, please. So what we're going to talk about today, we're very excited to have a brand new product to talk about. It's been a while. We have a brand new product called KP Plus, and really what it is our traditional HMO, and it adds a few out-of-network benefit features to it. It's available for large group and small group both. It is available now. We have started quoting it already on both segments. You are seeing it pop up on your renewals. We got very late approval from our regulators for January 1. We hope it to be a little bit further ahead, but now we're full throttle, and I'm really happy to report we've actually had several sales on this new product already. So that is great. It is available in our service area, all of Oregon service area. It's available in all of our Washington service area, Clark and Cowlitz County, already said for both segments, large and small. As I said, it adds a limited amount of out-of-network benefit. It has 10 services that you can obtain outside the Kaiser network, which requires no referrals, no prior authorization. It is just like the PPO plans you sell every day with the out-of-network benefit. The nice thing about this product is it's only about 2% premium more expensive than our traditional plan. So as you show this to your customers, you are able in large group to pair this with a traditional HMO, with our dual choice PPO. If you're on a renewal plan with one of our added choice plans, you can pair these plans as you care to, as what makes sense to your customer. You can have 2 KP Plus plans. I could go on and on with all the combinations, but that's the rule. In small group, you get 3 plans. It can just be 1 or more of your plans that you offer to a small group as well. So exciting around the availability to your customers, and this is something that's been very, very well received so far. So who is this great for? You've had a pediatrician that you've had for years. Maybe you go in there once, twice a year to that pediatrician, and you can do that. You have a specialist that you like to keep, that you can go once, twice, and maintain that relationship and still get the great quality of care with Kaiser Permanente for the more, I guess, in-depth things. This product is probably not for someone who has pretty ongoing conditions with an existing provider. As Amy's going to explain, it's pretty much the routine outpatient sort of benefits that this applies to. And I will say that just like your PPOs you sell with an out-of-network benefit, there's no guarantee the provider will see you. There is no guarantee it won't be some kind of balanced billing situation. It's important that you educate your customers to this event, but again, no different than a PPO. But I will say that these services are typically not the services that get that balanced bill situation. But the minute you say, don't worry about it, you know, somebody will have a situation. So it's just good to counsel your customers. You're going to have a higher copay. That potential for a balanced bill is there. We're not trying to hide behind anything. And we're going to give you a lot of tools to help the member keep track of how many of these services they've used, tools to help you explain it. And Amy is going to go through all those details with you. So really excited to have you today. Appreciate your time. Hope your power's got to be working if you're on the internet here and everything, but welcome. Without further ado, I am going to kick it over to Amy Benish, and she's going to walk you through all the nits and gnats. So take it away, Amy.
Thanks, Kevin. So I am now going to spend about 30 minutes going into detail of what Kevin just said. I think he did a great overview and kind of getting things started. If you want to go ahead and move to our next slide. So really looking at how does this product fit into our portfolio? It really falls right between our traditional core products, those HMO, DHMO, CDHC products, and a full-blown POS or PPO product. And really, you know, Kevin did a great job of talking about kind of the target market. We see a lot of employees looking for this product if maybe they travel a little bit more. That's been a great reason to launch this product. Employees may want a little more flexibility. They're 90% convinced that they want to use our integrated delivery system, but they just want to make sure they have that security to check in with a known physician while they're making their transition. You know, we also see that this helps with folks that want to maintain that traditional relationship. And really, you know, this adds great if people are like working remote for an extended period of time. We all can do that much more frequently this year. So that's really kind of where this product falls into the portfolio. Next slide, please. So this really combines our great Kaiser Permanente integrated top-rated care with the choice and flexibility for our members to see those out-of-network providers on a limited basis. And the way the product works is we also work on making sure that those costs stay down as members can work on using both out-of-network providers and using the Kaiser Permanente delivery system with lower cost sharing. So this really gives your employees kind of that quality care in that when and where it works best for them. Next slide. So here we're going to kind of get more into the details. And as I go along, I'm going to give you lots of examples. So this, again, starts off with our base core product. And you get everything in that core product that you're used to getting from Kaiser Permanente. You get a fixed and lower out-of-pocket costs. You get 24/7 virtual care, all of the preventative care services, access to kp.org. Really, you know, that HMO, you know, experience that you expect from us. Plus, you do get care from out-of-network providers. It's 10 doctor visits or outpatient services per year. This includes lab, radiology. This gets to physical therapy, So those type of outpatient services. It includes 5 out-of-network prescription fills per year. And these charges, so these 10 visits and 5 visits, do not count towards your out-of-pocket maximum. Because this is pure out-of-network, some providers may require payment in full at the time of service. I'll go into a whole set of details about billing and services. And some of the services aren't covered. This is focused on outpatient services, so things like inpatient care, maternity, prenatal care, surgery are going to be provided by our Kaiser Permanente delivery system or our affiliated providers that would be part of any of those core products. And for this product, you don't need a referral to any of those out-of-network physicians. Next slide. So here's where I'm going to dive in a little bit more on the billing. So as with any health plan, when employees or members access services with an out-of-network provider, they can be subject to balance billing. They may have to pay the full amount when they receive care, and they may need to submit a claim for reimbursement. Now we have online ability, so they can submit a claim online. They can send it in the mail if they're still doing that to get that claim reimbursed. And really talking about balance billing. So this always comes up when we talk about having an out-of-network benefit. And really what we've seen in our other regions that offer this product. So this product's been around for a while. It's been around for over a decade in our Colorado region. It's in our Mid-Atlantic regions, Georgia regions, Hawaii. So we have a lot of experience. And really what we see is looking at our products that have out-of-network services, balance billing normally occurs with those high dollar services. Things like inpatient, surgeries, and those services are not covered out of network. So what we've seen by pulling all of our call logs and reviewing is we're not hearing about balance billing being reported. Now, to what Kevin said earlier, it's not a guarantee. I mean, the second we say there's no balance billing, one of you guys is going to call us and tell us about a balance billing situation. But what we've discovered is it's not very common. That for the most part, our reimbursement methodology does cover the costs of these services. So next slide. So how does it work? Well, what are the benefits and costs? So for this product, you are going to see a $20 higher copayment in most services if you use out-of-network care. So, our great, Permanente virtual care is, 0 copayment if you stay in network. If you access that care from a out-of-network provider, it's going to be $20. Same thing with x-rays. If it's $20 in network, it's going to be $40 out. And then, looking at, emergency care, that is covered in network no matter what, emergency coverage. And then inpatient hospital services are not covered out of network. And then you are also going to see about a $20 difference in that pharmacy benefits. And I'll dig in deeper on that pharmacy benefit and how it works in future slides. Next slide. So, these are the kind of services that you can really look at, on how it's divided. In network, all the typical services, out of network, limited to, routine office visits, specialty care, prescriptions, lab, x-rays, mental health. Go to the next slide. I'm going to dig into a little bit more about how that pharmacy benefit works. So KP Plus out-of-network pharmacy. So this is limited to 5 out-of-network fill limits. It'll be a $20 higher copay, 10% higher coinsurance. We have 4 drug tiers: generic, brand, non-preferred, and specialty. Mail order is not covered out of network. So if you do want to use a routine mail order benefit, that does come back in network and is through our KP mail order service. And you can get up to a 90-day supply on the out-of-network benefit. Now, we are using our typical KP Northwest commercial formulary for this. So it's the formulary you're used to on our other products. We will be handling the UM internally for this. So we won't be delegating the UM on this product to like MedImpact, who is our PBM. This will be done internally at KP. And we have a couple exclusions. So oral chemotherapy drugs are not covered on the out-of-network benefit, and clinically administered medications are not covered on the out-of-network benefit. So those are 2 exclusions. And we will be using the same UM processes that we use on our traditional products on this products. So what is the network? So the out-of-network pharmacies would include all pharmacies that are outside of our classic network. This includes MedImpact pharmacies and the wraparound network. Even though we are using MedImpact as our PBM, this is not marketed as MedImpact. It's strictly, how we're funneling the claims. And then in Lane County, the MedImpact pharmacies we use there will remain in the first fill network. So, in summary, it's a 5 fill limit. The rules, the formulary, the process, same as our traditional products: exclusions, oral chemotherapy, clinically administered drugs, and then this would include all of our pharmacies, all pharmacies outside of our classic network. Okay, so now we're going to start getting into a lot of the details about how it works. So how things would count. So office visits, the single office visit will count as 1 service. Outpatient, PTO-TST, 1 service for each therapy. So if you are getting PT and then you go over and receive occupational therapy, that would be 2 visits, 1 with the physical therapist, 1 with the occupational therapist. Lab is covered per service. So multiple labs can be considered 1 service in the draws. The x-rays are per covered service. So, even if you receive multiple x-rays in a visit, that's 1 service. However, if it's split, so if you are getting an x-ray and nuclear medicine imaging, that would be 2 services, as it's two categories. So that's kind of how the splits are done. So based on the utilization that we see in our other markets, the utilization for most members on this product is about 3 services per year. So it's we rarely have individuals that reach that 10 service limit, on the products. So I am going to now start digging into 3 different examples on how this product works. And, thinking about, Kevin talked a little bit at the beginning of the presentation on, what is this good for? How are people using this? And like I said, it's been in several of our regions for a long time. And so I've had the opportunity to really dig into how are members using this product. And what we've seen in running some of the data is some of the common ways that you see people using this product is for things like mental health therapy. It's often really difficult to build that relationship with a mental health therapist. And if you've spent years doing that, you may be great wanting to move over to Kaiser Permanente and our integrated delivery system for everything, but you really want to keep that trusted relationship. So we see a lot of use of, you know, every other month, every month, visit with mental health therapy. You also see a lot of physical therapy, where people are in the middle of a course of treatment when they want to transition and they want to keep that course of treatment. Or maybe they just have, a physical therapist or some kind of a therapist that they have a relationship with. I mean, that's the situation with my family. We have 5 competitive athletes and there's lots of injuries. And we happen to have a really great relationship with a sports medicine therapist who is outside of the Kaiser system. See him once a year, maybe twice. Everything else we come inside for. So those are kind of services that we really see a lot of folks using. So let's go back to Jill's story. In Jill's story, she is feeling overwhelmed. She's feeling anxious. It's been hard being away from her peers, working remotely. So she decides to have a couple sessions with an out-of-network mental health counselor. But during one of those visits, her counselor also suggests that she has her blood pressure checked and she can go right next door and get it done. So, Jill finishes her visit. She goes next door, has it quickly checked, see where her blood pressure is. And, she ends up having 2 visits deducted from her KP Plus visit, one for her therapist, one to have her blood pressure drawn, and she pays that higher cost share. But she doesn't want to continue using out of network care. So she calls her Kaiser Permanente primary care physician, schedules an appointment. They take care of getting her blood pressure checked. Her primary care physician suggests some other ways for her to manage her anxiety, such as yoga. This time she got to pay a lower cost share to have her blood pressure checked and is able to use our on-demand video workouts through ClassPass to help her with that yoga. So in this case, she had no visits taken out of her out-of-network. And then she gets her prescription, her Kaiser PCP prescribes her blood pressure medication. She walks downstairs to one of our pharmacy, gets it filled. It's $5, and she doesn't have to use any of her fills. But in this scenario, she also could have walked to the pharmacy that's closer to her home and gotten the prescription filled for a higher copayment. So really, this just shows how we can integrate between the care experience, lower cost shares, and still make sure that she is getting everything she wants. So this is really one example on how to use the product. If you want to switch to the next slide, I'll go over another example. So this example really looks at some other ways to use the in-network and out-of-network. In this situation, a KP Plus member has the flu and decides to go see their doctor, who is a specialist out-of-network. So the specialist orders some lab tests to rule out pneumonia. They get a prescription for flu medication. So he pays a higher cost share and has one visit that counts down from that 10 service max for seeing the specialist. And he has lab done. And in most cases, the labs will count as one service. In some situations, depending on the number of panels requested from a lab, sometimes they come in as 2 services. And then he got his prescription filled out of network. And so that one fill went to the 5 fill max. So he had some higher cost shares, but he had about 2 to 3 visits out of his 10 services and then 1 RX. In the second option, where you can kind of combine that in-network and out-of-network, what you see is he starts with that out-of-network specialist, but instead of going to an out-of-network lab, he brings the care inside. And at that point, he gets lower cost share and doesn't need to use his max. And then he could also take that prescription and get it filled. So in this situation, he still saw that out-of-network specialist, but it only counted as one visit towards that service. Okay. And then the next one is a pharmacy example. So here's a couple examples of how to use the pharmacy benefit with Fred and Carol. So, Fred decides to fill a couple of prescriptions at a Costco pharmacy, one for eye medication, one for blood pressure. Each of those count as one fill. Because Costco is in the MedImpact network, it goes through that as a PBM, and he's only responsible for his cost share at the point of service. He doesn't have to pay up front, super easy. It counts as 2 visits, slightly higher, but he got to pick up his prescriptions when he was doing his grocery shopping. Carol wants to get her prescription at a local family-owned pharmacy that's on the corner. One of the few pharmacies that is not part of the MedImpact network. And so she may be asked to pay 100% of the cost of the medicine at the point of sale, and then she'll have to turn around and submit a claim where she'll be reimbursed minus her $20 copay. So, a couple different ways to use the out-of-network benefits. I am going to now dive in for a few slides on our service model. And then I see that we have lots of questions that we will be able to get to at the end of the session. So if you want to go to our next slide, will be our member onboarding process. So we really want to help members transition onto this product. It's a little more complicated than our normal HMO, and we really want to provide that really good service. So for our KP Plus members, we have a combined onboarding through our traditional new member welcome desk that you should be familiar with for our core products. And we will have the expert advisors supporting as well. So they will start with the new member welcome desk, get all the information on how to transition into the Kaiser Permanente system. And then they will also be asked if they want additional assistance on coordinating their out-of-network care. And at that point, they can be handed off to an expert advisor who is a specialist in our choice products, who will be able to help that member, talk about, how to use the out-of-network benefit, what the visits, how the visits work, how to maximize it, how to get an appointment, and cover that off. They will also receive an SMS text to the member that will allow them to schedule an onboarding call with an expert advisor if at the point of the new member welcome call that they opted out of that. And then there is a member onboarding video that also talks about how to use these services. So, a personalized onboarding video. So really lots of options on trying to get the members off on the right foot. Next slide. So, here's some of the tools you will see. There is an ID card that has KP Plus on it. It talks about, in-network and out-of-network benefits. They will get that enrollment confirmation text, so they know that they're enrolled, and will be guided to kp.org for more information. And then in addition to supporting our members, we have a pretty robust support model for you guys as well. If you could go to the next slide, please. So we have if a member has a question or a concern, they can call our MSCC. They will be routed to our designated tier 3 reps because we have our highest level reps supporting our more complicated products that have out-of-network and in-network services. And then for our sales and account management friends, our employers, and our brokers, really, if you're having questions, if you're having issues, please go to our employer broker services unit. It's really good to kind of funnel, any concerns, any questions, any escalated items through that group, because they will track and then report out to several folks throughout KP if we're starting to hear trends, if there's something that's not working with the product. That's where we're really going to get kind of that big picture feedback, not in the moment, or they'll definitely help you, but really understanding if there's something that needs to be addressed. And then the last slide really talks about who our partners are. So we have a lot of dedicated escalation teams. We have escalation team at our MSCC, which is our service center. We have the expert advisors that I talked about. They're great with helping members with in the moment escalations. And then our employer broker services team. And, they really do have, consistent resolution process and guidelines. They know who to go to. They have a lot of really deep workflow training for these teams. And I am going to now, I believe, hand it back to Kevin, who has a video for us to watch as we gather your questions for the next part of the program.
Thank you, Amy. Appreciate the information. Just know we are compiling your questions. We're going to show you a short video about the product. After the video, then we're going to have some other folks that we brought in to help answer some of your questions. So we are going to get to them. I'll just say right off the bat, probably the number one question we're getting is, are we going to be able to get this information? We're going to show you a video. Am I going to be able to get this video? No, of course you know. Yes, of course we're going to get that to you. Need to give us a day or two to assemble this. Then we'll push out some links for you to access the information we gave you today. We're also going to tell you some more information about where you can find collateral pieces, etc. So yes, we will be giving you that. So again, let's go ahead and roll our video that's available to you as well, and then we'll go into our Q&A session after that.
At Kaiser Permanente, you get high-quality care and convenience with our integrated care model. But there's that one provider you still want to see a few times a year outside the Kaiser Permanente network. What you want is flexibility and choice. Well, now you can have it with Kaiser Permanente Plus. With KP Plus, you get convenient, high-quality care from Kaiser Permanente, plus the flexibility to get care from out-of-network providers for a limited number of times each year. Per NCQA, you'll get integrated care from one of the highest-rated health plans in the nation, plus the choice to get care from out-of-network providers for office visits, certain medical services, and prescription fills, either at home or while traveling anywhere in the nation. Get flexible care that meets your needs with KP Plus.
Welcome back. Again, I'm going to get you this information. This section, like I said, we have compiled a lot of your questions. And if for whatever reason we don't get to your question today, know that you can always ask your sales executive or your account manager later. We can do more of this training for your brokerage house if you care to. Happy to do that as well. But for now, we're going to go through some of your questions. I have a few special experts we brought in just in case some of the question detail gets to a level that I can't handle. There's nothing Amy can't handle, but she's tired of talking. So I'm going to introduce Raina Morris. She's a director for our large group labor and trust, multi-state, and I'm sure I'm forgetting something. Raina, apologize. She's in charge of basically everything. Colleen Ford is product manager for us in the Northwest, knows everything about this product there is to know. And Eric Hegestedt is our newest senior director for small group. He's kind of a big deal. So we brought him in here as well. So I'll start with some of the low-hanging fruit questions we got about is KP Plus available in both Oregon and Southwest Washington? And yes, it's in all of our Kaiser Northwest service area, all of Oregon and Washington. It's available for both large group and for small group. Will you be making the slides available after the presentation? I think I've said that 12 times. Yes, we will, but give us a day or two to get that together for you. And we will push out links where you can get that information. I would just say generally there's some network questions. And I want to make it clear that this product, I kind of call it the Goldilocks product. It's the just right. We have our traditional HMO, and then we have this product that's just really just our traditional HMO and all the Kaiser, Portland clinic, our partner providers down in Lane County. And it just adds the ability to use some out-of-network benefit. So it's important to understand that. Now, it is a good question is, Raina, if I can call on you first, please. What if I just stumble into a first choice provider that is technically out of network for this product? Does that have ramifications? Can I do that, et cetera? So
you certainly can do that. You can go to any licensed provider. That's the beauty of this product, is that you have that complete flexibility to go to any licensed physician or medical provider. There are some limitations around alternative care providers, and we can get into that if needed as well.
Just to be clear, if you're on the KP Plus product, you go to a first choice provider. That means that's an out of network. One of your counts, your tabulations of your 10. So the odds of you getting balanced bill, I think, go way, way down if you happen into one of those. But just know that this product is just our HMO with a bolted on out of network for you as well. Colleen, if I could ask you, seems to be there was a little confusion on the differences between this and our PPO Plus product. Maybe people understandably getting their wires crossed a little bit about, are we talking about this or that? And I'll hand it to you, please.
Sure. Thank you, Kevin. So our PPO Plus product is really strategically focused on providing PPO provider and Kaiser in-network care to members who are living outside of our KP Northwest service area. The KP Plus product itself is strategic in offering this in and out of network tier coverage inside our service area. And just like Raina had mentioned, any licensed provider outside of really the KP network and our affiliated partners is considered out of network. So regardless if a member chooses to go see a first choice or first health PPO provider, it just falls in the umbrella bucket of out of network. But because they are a PPO provider, we typically have better rates contracted with those. So technically our members will probably see a higher cost savings if they were to go through a network that we've already contracted with. So.
Thank you, Colleen. One more question I think I'll handle is, one of the questions out there is, where can we find what physicians and or clinics will accept the plus plans? And the answer is you won't find a network of those who accept it. Just like you won't find a network list for a PPO of the out-of-network providers, because it's limited, literally every doctor on earth. And we can't predict who will accept that, accept it. We can't predict who will bill on the member's behalf. So there will not be a list available for those out-of-network providers. It's any willing licensed provider you can go to. Next question, Amy, I might come back to you, and I know you're tired of talking. But the question is, when a member receives an EOB for out-of-network services, is there information as to how many out-of-network services they have remaining?
At this point, not on the EOB. That's an enhancement that we're currently working on to get updated in our systems. They can go online, and starting we will also be able to send out SMS texts when they get close. So we are notifying members when they get close to their limits. We're sending texts. Our expert advisors are reaching out. We're really making sure folks know that they can call in and check. But at this point, we haven't gotten the upgrade on the EOB yet.
Thank you. Eric, I have a question for you. It's about wired enroll. The question is it, I just pasted the, is it possible to emphasize the need to provide mobile phone numbers in the employee applications or when using wired enroll?
Thanks, Kevin. Yes, it is possible. We can work directly with wired enroll for this specific plan to make it important as that field gets captured during the enrollment process. And some of you may have seen, we're actually transitioning our quoting platform to wired quote starting March 1st. We do like to see enrollments come through wired enroll, so it's a really good opportunity for an increased number of applications and member information coming through that channel. When you do have a wired quote account, you obviously can use wired enroll for free. With our transition, you will be able to use that wired enroll free option as well.
Thank you, Eric. Raina, I've got one for you. Is an out-of-network lab visit, regardless of number of lab tests per occurrence, considered one of the 10 visits?
That's a fun one. Thanks for that, Kevin.
Yes, I'm a giver. I'm a giver.
I'll say, typically, if it's all done in the same session, then yes. Where it might get a little bit different is if some of those lab tests are preventive and some of those lab tests are not preventive. And then you could get billed for 2 services, or it could be counted as 2 services.
Thank you. Colleen, back to you, if you would be so kind. A lot of people want to know where they can find plan summaries or flyers, etc., on this product.
Yes, thanks, Kevin. So we do have a lot of materials out on account.kp.org, and we have our drop-down menu. So if you go into our choice product microsite, you can choose KP Plus as part of the drop-down menu, and that will take you to several materials and outline all the good details about how this new product and new plan works.
Thank you. I want to reiterate, there was a question around prior authorization. Prior authorization is not required to see one of these out-of-network providers. Member can just self-report. Sometimes a specialist will argue with you, I need a referral to be seen, and that requirement's not coming from us. So just know that, important to understand. And Colleen, if I could come back to you, please, on a pharmacy question. A couple of questions around pharmacy are one just around mail order, out of network. And the other one is, can an out of network physician call a prescription into Kaiser for Kaiser to fill that prescription?
So I'll take the latter question first, which is yes. We do accept, and part of the plan design is that any out-of-network provider can call in a prescription on behalf of a Kaiser member to a Kaiser pharmacy. So that is absolutely an option. One of the restrictions of the KP Plus plan is that mail order pharmacy is not an option. It is not a covered benefit. So if the Kaiser member wants to use mail order pharmacy, they will have to use it through the Kaiser mail order pharmacy benefit under their in-network benefit.
Thank you, Colleen. I think I'll take the next one here. If out-of-network hospitalization is required due to a life-threatening situation, what is the coverage? So just like our HMOs, KP Plus absolutely covers you for emergency situations anywhere really in the world. So that is no different. It's not counting toward that out-of-network limitation. You are covered for urgent and emergent, especially hospitalizations, anywhere by our plans. So next question. Let's see if I can. So I think one of the questions was, and Amy, maybe I come back to you, is this one's a little more, this is a great question. Is urgent care one of those 10 allowed visits?
So urgent care is covered like it would be covered on the HMO product. So for an urgent care situation, you would go to an in-network urgent care facility. That can be a Kaiser Permanente facility within our service area. If you're outside of our service area, we have arrangements with folks like Minute Clinic and CVS, Concentra, Cigna. So urgent care would not count on your plus benefit as long as you see an in-network urgent care provider. Now, there is a couple nuances. For example, sometimes folks go to urgent care and then have a follow-up visit. And follow-up visits often aren't covered on our HMO, but if they happen to still be out, if you go to that follow-up visit with an out-of-network provider, that would count as one of your visits. So simple, it follows the HMO rules. So urgent care is covered as an in-network HMO benefit. If you have services after that urgent care episode with an out-of-network provider, that could count against your visits.
Thank you, Amy. Eric, I'm coming back to you. Someone wants to know, who do I contact about Wired Enroll, Wired Quote, and signing up for it?
Yeah, there's a couple different avenues you can go. First and foremost, we will be sending out in the next week another email notification of us transitioning our quoting platform. And through that channel, you'll be able to get some instructions on how to create your account. You can also reach out to your sales and account management staff that is assigned to you. In the last option, if you go to wiredquote.com, there's a customer service email and phone number where you can call for help.
Thank you, Eric. Colleen, we're going to come back to you, please. The question is, do you see the KP Plus plan replacing the 3-tiered point of service plan option? Specifically, they're asking about small group, but we could expand that really to large group as well.
So a short answer is no. This is just one more product option that we've included as part of our overall choice product portfolio in the Northwest region. The 3-tier point of service plan will remain for our small and larger groups, But KP Plus really, the purpose of the new product is to help bring in and provide our groups who are a little bit hesitant to be completely confined to the Kaiser network, but still would really like some choice to be able to go and see maybe some existing and manage those existing provider relationships. So really the purpose of KP Plus is just to add one more product to our total portfolio as an option for our groups and our members.
Thank you, Colleen. I had some chat in here about the importance when we enroll a group of capturing the member's phone number and the member's email address. Amy went through a lot of our outreach efforts that we do to help educate members to have them have a more positive experience onboarding. Key to that is having a way to reach out to them and help educate them ahead of them having a question or a problem. So if you can really emphasize with your customers to include that member information, super helpful to us. So here's a question, and maybe back to you, Colleen. It's kind of a follow-up to your last question. Isn't the 3-tier point of service product moving to a 2-tier point of service product?
So there is a migration strategy underway to manage those accounts, our mid-sized accounts from 51 to 499 members, to eventually migrate everybody off of the added choice 3-tier point of service plan and into a dual choice product plan. But that is a several year strategy, if you will, and that is targeted to our mid-size accounts. So we do not right now have a strategy for any groups, any small groups on the point of service plan. It is specifically targeted for our mid-market size groups. So at this point in time, yes, there is a strategy, but it is over several years, and there is no hard and fast deadline. And KP Plus is not meant to be part of that strategy. KP Plus is just completely separate and added as a whole different option within the portfolio. But the added choice 3-tier migration strategy is really targeted to the dual choice product within our portfolio.
Thank you, Colleen. Now, by my own very sketchy accounting, I have seemed to have run out of questions that you have submitted, and I'll just apologize up front if I omitted something that somebody asked that I overlooked. And if any of my panel members saw something that I missed, kindly raise your hand. But I think we got to most of them. And just, Raina, of course.
I do see a late breaking question that you might not have seen around how to submit a claim to get reimbursed when using an out-of-network provider. Some of those providers might be willing to send the claim in and submit that for the member. Others might not be willing, and when that's the case, then the member can either submit those via our online KP portal, or they could send it, they prefer the more old-fashioned way, through the mail as a paper claim.
Perfect.
To do that or online.
Thank you for cleaning up after me too. I appreciate that. You're used to that though, right? Thank you.
We got each other's backs.
Yeah, that's right. That's right. Thanks. Okay, so again, just want to repeat that we are going to push out this information to you in a couple of days, so give us a little time. And if you do have other questions, your representative, your account manager, your sales exec can help answer any of these questions. Go through it again, no problem. Happy to do it. And with that, my clock on the wall says we got about 3 minutes to spare, under budget, on time, heck of a deal. So all of you, thank you so much for attending today. Really appreciate you spending the time with us. Please be safe out if you're here locally, the crazy winter weather we're experiencing. And again, thank you very much. Look forward to seeing you all in person, and Talk to you soon. Bye now.